in situations in which we're talking about a condition that may be recessive in inheritance pattern, meaning both parents are carriers, there's a 25% chance of having an affected child. Um, if we draw out sort of that Punnett square that we learned about in biology back in the day, there is a risk that other children could either be affected or may be carriers. Certainly, if the condition that we're talking about is one that has variable expressivity or a differing age of onset, where we can't be sure whether or not siblings could also be affected, we would absolutely recommend that those children be tested to make sure that they're not at risk of developing those health conditions. If it's a condition where it should be very obvious whether or not a child is affected, and we're really just talking about carrier screening for siblings, that's typically not something that we do in a pediatric setting, for a couple of reasons. Number one, it's hard to get covered by insurance if it's not going to be directly relevant to that person's medical management. Certainly, a lot of us are willing to fight that fight on behalf of the families if that's what's important, but sometimes that could be a challenge. But sort of at the baseline, as a genetic counselor, I do feel very strongly about people being able to consent for genetic testing for themselves and their right to know or to not know that information. So if this isn't something that's going to affect a child's health right now or in the immediate future, we typically recommend that we wait until those children are adults and can make that choice for themselves in order to preserve their own autonomy, and give them that choice when they become adults or of reproductive age.